full with simple system. It's the one full with is
Aloha, everyone, and welcome to our show. I'm excited tonight. Special show tonight with Dr. Jennifer Smith. I'm not sure if you all remember. If you guys have been following our show for the last 3 years, you will remember Dr. Smith coming out publicly to talk about the problems that the Department of Health was having with contact tracing and just handling the pandemic overall. And if you don't remember, I'm just going to pop up a real quick slide. I think many of you remember we talked about this on several shows, actually. And, Dr. Smith simply validated or reinforced what we had been suspecting for so long. And I remember trying to get Dr. Smith on. Obviously, we were not able to because of some legal issues. And, respectfully understood that, yeah, you went through some battles, treated so unfairly. But we had a lot of discussion. We had a lot of discussion with, remember, Dr. Scott Miskovich and all of them that came up behind Dr. Smith in her press conference that she had on Oahu. And again, just validating what we have been saying. Well, I was tickled pink when I found out that Dr. Smith had written a book. And this book was just released last week or maybe 2 weeks ago. And it is available at Amazon. I'll post this up again later, but this is Pandemic in Paradise, Insider's View of COVID Corruption in Hawaii. So it's going to be a great show. It is available on Amazon. I encourage everyone to go to Amazon and get this book. Because again, this is what our show does, right? Inform and educate. And we want to hear it from the people on the front line. And I can think of no better person to chat with today than Jennifer Smith. Welcome, Dr. Jennifer Smith. How are you doing?
Aloha, Mal. How are you? Thanks so
Oh,
much for having me on the show and giving me opportunity to share my story. I know it's been a while. As you can imagine, it was very stressful for me, very chaotic a few years ago when all this happened and quite traumatic, actually. So, taking me a while to kind of recover from all of that.
well, I can tell you, you had we call this the village. We've become the village, and you had a lot of supporters behind you, and so appreciative of you stepping forward. We had been talking about how the state was handling the COVID response. We did it every night. We're doing this show 7 nights a week, and we had been questioning the reporting. We had been questioning the handling of the pandemic, how inconsistent the state was between islands. In fact, even within islands, the confusion that the public was faced with because there was no consistency. There was no one voice. We had numerous voices. We had conflicting statements, conflicting interviews. And when you came forward that day, yeah, it made it very clear to us, at least in the village, and I think around the state, that our suspicions were real, and that in fact there were some questions. And I'll end there because I really want you to share your story and just who is Jennifer Smith and how did you end up at the Department of Health and what led to this uncovering of, again, what we suspected and finally was brought to light thanks to you. Uh, and we can start there.
Sure, no problem. First of all, I don't know if you remember, but I don't know if it's your nephew lived right next door to me. So No, there's an interesting connection. I know he had since moved away, but I think it was your nephew, Rick.
Yeah, it was actually my cousin, Rick
Cousin.
Sharman. Yeah, he's actually my first cousin. My mom and his mom are sisters.
Okay.
I remember him calling me up and telling me that because he's a villager. He watched our show, and I said, Rick, get her to come on our show. Get her to come on our show, man. But yeah, that's my first cousin.
Okay. Yeah, I would see him when I was go out walking the dog and stuff. So we would chat. But anyway, I thought that was interesting. Like you said, it's a village and small world. So um yeah, so I like to say that I'm a 3-degree microbiologist. So I have a PhD in microbiology and molecular cell sciences. Respiratory viruses are actually my subject matter expertise. I've worked my whole career in research and influenza viruses mainly, but I've worked with other respiratory viruses like RSV and mumps. I've managed government contracts for vaccine development and testing. So I've worked over 12 years in vaccine development and preclinical testing, which testing candidate vaccine animal models. So I have a good depth of knowledge and understanding on the research side in respiratory viruses. I then transitioned in 2016 to an epidemiological specialist position at the Hawaii Department of Health. So I then also worked as the influenza surveillance coordinator at the Department of Health as well. So work both at the research side as well as the public health side. So I have a good depth of knowledge and understanding from both sides to be positioned to talk about the pandemic and kind of everything that's going on surrounding.
You were involved with the contact tracing. Um, we had, again, like I said several times today, been suspicious of how the reporting was done. Contract Contact tracing was such a vital part of controlling pandemic. We want to limit the spread. Contact tracing was one way that we could control the spread because people would be informed. We would be, the state would let us know if we had a close contact, reporting that we had tested positive or were sick. They would do the contact tracing. It was level 1, level 2, level 3. We were led to believe that there were these hundreds of contact tracers that were doing this to ensure that the spread would be minimized. And what we found out later, and it was also validated by the legislature making a surprise visit over there at the contact tracing facility. And that upset a lot of people. But I'm a former legislator. Actually, I just got reelected to the council again. But
Oh, good.
that's what we do, right? Legislators provide check and balance and oversight, and I fully support what they did because again, the Senate committee was having conflicting information as well.
Right.
How did that all happen? And I mean, what led you to say, you know what, I cannot do this no more. I am not going to be a part of this system that is not being forthright with the public. What should take us down that journey?
Right. So first of all, there are 3 measures to the pandemic response, right? Or 3 areas that we looked at. One was testing, second is contact tracing, and then the third would be the prevention measures like isolation and quarantine. So, just to explain a little bit, contact tracing was picked up by the media, but I think it's largely misunderstood. So, it's really a task under disease investigation. So, even pre pandemic, we would investigate communicable diseases. Most of the time, it would be something like foodborne illness or um, we'd have a case of leptospirosis or Legionella pneumonia. So, we do use contact tracing as a tool for disease investigation. So it's generally used for any kind of communicable disease, but it was picked up by the media as the main thing. So, let me just explain a little bit about the overall umbrella of disease investigation. So, what would happen is somebody would test positive for a disease. So with COVID, we would get a positive test, and then our supervisor would then assign the case out to a disease investigation or epidemiological specialist, which there were 6 of us in the disease investigation branch. So we would get assigned the case, and our first duty, or the first thing I would do, would be request medical records. I try to get more information about the person. We'd need contact information for sure, a phone number, a way to communicate with them. The next thing would be to contact that person and to interview them. So we had specific interview forms and case investigation questions that we would have to ask. So the goal was to determine where the person may have been exposed. So how did they get this disease? That's what we're looking for. So the second part of that, say somebody had salmonella. Did they work in a restaurant? Did they do food handling? Are they a caregiver for somebody? Sometimes we had to do restrictions for those types of people, and also the people in their household who may have worked in those areas as well. So contact tracing was around for a while. Um, so with COVID, it was a tool again to determine, first of all, where the person may have been exposed. And then secondly, where or who they may have exposed, right? So who is living in their household? Where do they work? Who they may have had direct prolonged contact with. Are they a caregiver? Do they work at a hospital? So then we can contact those people and determine their risk. So what is your risk? How long did you talk to this person face to face? So that's kind of the crux of contact tracing. Now, um, yes. So in the Department of Health, we are the Disease Outbreak Control Division. In this division, we had two branches. So we had the Disease Investigation Branch, of which I was a member. And then we also had the Immunization Branch. So in disease investigation, we had 6 epidemiological specialists, and we're the ones who do disease investigation. So when people would talk about contact tracing, it's really disease investigators or epidemiological specialists who are doing that as part of the overall investigation, if that makes sense. We were then joined by our cohort epidemiological specialists from the immunization branch once things started getting ramping up and we were getting more cases. So there were 4 epidemiological specialists in that branch. So they usually would investigate cases of vaccine preventable diseases. So if you recall, we had a mumps outbreak in Hawaii a couple of years before, and they were the ones who were responsible for investigating all of those mumps cases. So they were already well aware of how to do the, initial contact to determine exposure, and then also to follow up with contact tracing.
How how many contact tracers were there when the outbreak or the pandemic started? And were they able to sustain the adequate number of contact tracers to infect? Remember, this is back when Delta was ravaging our village, and it was like everywhere, and the cases were amazingly high, and transmission was high. Uh, how did I know they had the call? They put out the call to whoever wanted to be contact tracers. You have to have a medical background and go get training or whatever. But at what point did we peak out at the contact tracers, and then at what point did we start to bring that number down? And were we ever were we always adequately staffed with contact tracers to effectively monitor or take care of the transmission?
No, so I mean, first of all, it's very, very difficult to contact trace a respiratory virus. You have to understand this is a submicroscopic particle that's spread by the air. It, uh, it's really unlikely unless it's super obvious, like where somebody had been exposed, because again, it's airborne, it's everywhere. So it's really hard to like to narrow that down. So in early 2020, I guess I'll start from the beginning. Um, I remember sitting at my desk, and has my background actually, my dissertation was on the live animal markets in Southeast Asia. So I'm well aware that these markets are rife with zoonotic diseases that can be spread to humans. So I often just keep an eye on what's kind of circulating out there. And I noticed a story about a mysterious pneumonia like illness in Southeast Asia, and I thought, "Okay, this could be something. We should watch that." And I really should have shared that story then, because now I'm like, we know what happened. We know what happened from there. But, Yeah, so we started early on by monitoring travelers. So, as you're aware, Hawaii has a deep connection with Southeast Asia, and we have a lot of our population that's from China, from Japan, from the Philippines. So, there are a lot of family connections, and there's a lot of travel associated between those countries and the state of Hawaii. So, we were initially starting by monitoring travelers coming from the area, and that took us into, February. I don't know if you recall, but the Daniel K. Inouye International Airport was one of the 7 hubs where they funneled all the people from China that were returning, to the US through. So people in the general public were very, very nervous and they were very concerned. So we also not only did we do disease investigation, but we also fielded phone calls from the general public, from clinicians, from laboratories to answer questions, general questions from people. So we started getting just inundated with phone calls. So again, as disease investigators, we had multiple duties. Um, our first case was not until March, early March of 2020. So the first case is when everything just started to happen, right? I look back now, and again, you mentioned the book Pandemic in Paradise. If you're interested in reading, there's actually credible evidence to suggest that the virus was in Hawaii earlier than the first confirmed case. So I have evidence that the virus was in Hawaii probably as early as January of 2020. So the first case wasn't detected in March until March because we didn't have the PCR test until the end of February from the CDC. So once we started doing the testing, that's when the detection happened. So my first case, I think it was assigned mid to late March 2020. My first case had 40 contacts. Okay, so you can imagine it took me 3 days to call those people and to interview them, 3 whole days. Um, my second case, I had 30 contacts. So now I have 70 people I have to call daily. I have to call to do well checks. I have to call the people who tested positive to check on them to see how their symptoms are, if they're resolving. Now, early on, we didn't have clear criteria to release people from isolation. So we were following people sometimes for a month. So it became really cumbersome very, very quickly. So you can imagine it just grew exponentially. So there were 6 of us initially who were being assigned cases. There was one of the staff members in the immunization branch who was helping us early on monitor travelers because most of the travelers that we were getting through Hawaii didn't speak English, and I don't speak Chinese. So, we had staff in the department who could speak Chinese. So she basically had a full-time job just contacting all the Chinese travelers because she could actually speak to them and understand them. So she joined us early on monitoring travelers. It wasn't until later, I can't remember specifically, that we had 2 of the or 3 the other 2 staff members from the immunization branch who then joined us. So I just wanna make a disclaimer when I'm talking about what was going on. It's from my point of view as I sat in Oahu. So I'm not really certain about how things were on the outer islands because it was so chaotic and I was underwater. I had no opportunity to really pay attention to what was going on the outer islands. Once in a while, we would be made aware of something, some big outbreak that was going on, maybe in Maui or Big Island. But those islands, as you mentioned, each of the islands kind of handled the situation a little bit differently. I do remember Kauai. So Kauai was really interesting because it was really quiet there. So you guys were really lucky early on that there were very few cases. I remember there was a couple who traveled from the mainland who were the first cases in Kauai. And it was very quiet in Kauai for a long time. And we used to joke with the epi specialist in Kauai that we wanted to go there. We wanted to go there to get a break because she had no cases, and that was great. Um, and then you remember that we had the first shutdown. So I believe it was in April, end of April, maybe, that the governor issued the proclamation for the stay at home order, right? So that actually helped us a great deal. So up until that point, we were actually doing pretty well with like keeping up with cases. The shutdown was so welcome for us because we we had fewer contacts. So our cases may have had, you know, the spouse at home. Um, there were a lot fewer contacts, which made it much easier for us. I mean, I was at the point of making like 50 phone calls on a Saturday to check on people. I mean, it was absurd amount of phone calls. Now, just some other things that, you know, kind of started to happen was we well, I actually sent an email to leadership and I wanted to have daily briefings because, as you can imagine, in the beginning, it was rapidly evolving situation. So every day something was happening, something new was coming out. The CDC had new guidelines or something was happening. We were fielding all these phone calls. We didn't know how to address some of these things. We're just we're on the front line and our leadership ignored us. They did not respond to my email. We got no information from them. We were basically on our own. So, luckily, my background as a virologist really helped me because I know what PCR is. I understand the testing. I understand the technical aspects of it. I understand respiratory viruses. I understand. So for me, when people would call and ask me questions, I would tell them, I have a PhD in virology, and I could just hear the relief in their voice because there was a lot of confusion and frustration out in the general public. And so when I would tell them that, they were like, oh, okay, can I ask you questions? Because they knew that I would give them more valid information. And for me, it was nice to be able to help people and to reassure them and to calm their fears. So, um, it just became very overwhelming very quickly, and we kept asking we kept asking, like, where all these people were that Sarah Perk kept talking about because we were again, we were the ones calling all these people all day, every day, 6, 7 days a week. And when we started out, just a little side note, when we started out, we had we didn't even have enough cell phones for us. So we would usually take a cell phone home if we were on standby call, but we had these little like Motorola flip phones, like old school 90s style flip phones. And we had to call people. We didn't have enough for all of us. So sometimes one of us would just take the weekend off. We didn't have a phone to be able to use to call everybody, to check on people. So we were really under resourced. We were ignored by our leadership. We kept crying out for help, for more information. Like, how do we address this? What do we do? We just weren't getting anything from Sarah Park, from the director. Nobody was talking to us. Nobody. And the first thing in a disaster emergency response is clear, open lines of communication. That is vital. It is vital for your team to have clear, open lines of communication. So that was even more distressing to us. That just added to the stress, right? Because now we're answering these questions to the general public and we're having to find the information on our own. I'm actually teaching my coworkers, I'm trying to help them and educate them because none of them have the background and expertise and knowledge that I have. So that was actually, I know people were very frustrated by the pandemic and upset and scared, but for me, it was like I finally get to talk about like all of this that I know. I get to talk about viruses. I could talk about PCR. I can explain, antibodies. I can help reassure people. And for me, that was like finally being able to put that into practice, and even with my own coworkers. And they felt so much better and so much more reassured having that, knowing they could come to me and ask a question and get this valid information.
Yeah, and I think like you mentioned earlier, and some of the people that you called found relief in speaking to an expert, a doctor, a scientist, because the messages that were coming from the people in the medical field, and I can tell you this because we were having them on our show. We had the Workins and the Miskoviches and the Browns, the Aldenbergs, and the Dr. Kim from South Korea. We were having all these experts. And their message was not in line with what we're being told by our political leaders. And, coming from a politician, I am the first to admit that when we end up in a health crisis like this, uh, number one, we should have a competent Department of Health. And I think even the statutes uh, dictate that the Department of Health director should be in charge for quarantines and so forth. And it was not. It was everything was being done politically. And we saw this. We saw the information as we watched the live Senate special COVID committee hearings. We saw uh, the administration struggle with them, and the legislators struggling because they were receiving information uh, differently from what they were hearing from the experts like yourself. And that caused a lot of problems for the general public. I did want to address Kauai's low numbers. We had a mayor that did things differently. He's implemented a curfew, which he took a lot of hits for. Uh, and as time progressed, he did the resort bubble. He did all of these things. We set up our own police department outside of the airport to make sure everyone had their card and that they were heading to where they said they were going, that the hotels were, they actually had a reservation. I mean, this took a lot of resources, but the result was Kauai got through it quite well compared to the other islands. And it came with a price, but at the end of the day, I support that decision 100%. So, and as far as contact tracing here in Kauai, I know I have a couple of friends work at the Department of Health. That's, they were thrown to contact tracing. Their normal jobs were put on the side and they were reassigned really to do contact tracing. And it was a struggle. And I can't imagine what it was like on Oahu or the other islands with the caseloads. We didn't have that many cases, but we also didn't have as many resources either.
Right. So we finally got assistance. So we finally just kept pushing and pushing. I have to thank my coworker. She's just amazing. I love her. I love her tenacity. And she just kept pushing and pushing. And she said, I'll organize and set up a phone line. I'll organize and set up. So on top of everything else, she was like basically manager for like getting us assistance. So the public health nurses were just invaluable to us because we ended up, a lot of the public health nurses were out because the TB clinic was closed, the schools were closed. So basically they were assigned to assist us. So in terms of contact tracing, when they first started, they would do well checks. So when we started getting more and more cases, they came in and started doing well checks. So that's one thing, they're nurses, they can handle calling people, how are you doing? Meanwhile, I could call the new cases and do the case investigation. And then, so that was really great. The problem was we didn't have consistency. So we didn't have the same people all the time. So you can imagine we come in, we have to train people. We have to train different people every day. That's a big time consummation, right? To take us away from case investigation. So the other issue and something that I really want to highlight is that when you're talking about the politicians and the public officials were making decisions. So now here's the issue, and I think it's something that people don't really understand. The data to rely on to inform the public policies and the public policy decisions that were implemented was corrupt. So let me explain what that means. So as a disease investigator, I call and I interview the case. So the person who tested positive, I collect that information. We have to put it in our disease surveillance system. So we have to do all the data entry. Okay, that data that is collected from all of us doing those investigations is then compiled and analyzed, and then that is sent over to help inform those public health policies. So if I am inundated making 50 phone calls a day, I cannot also do data entry. So you can imagine the data was corrupt. It was not being collected. It was not being collated. It was not being done in real time. There was a huge lag time between the data that was coming out to the public and what was actually happening out in the community. Does that make sense?
It does. And in fact, for some reason, I remember there was, and correct me if I'm wrong, but to my recollection, which isn't very good, was like a 2-week lag between what was being reported and what was actually happening real time. I don't know why that 2 weeks is sticking in my head, but that's kind of what I remember.
Yeah, I mean, the gap got wider and wider as the year progressed because we had more and more and more positive. So right after up to the first shutdown or stay-at-home order, we were able to pretty much keep up. So when the first shutdown order came in, it was like, okay, now I can breathe. I can catch up on, getting my data entry done, closing out these cases. When now another thing I want to point out is that stay-at-home orders and shutdowns were implemented in order to put infrastructure in place in order to handle a surge in cases. So again, it's simple arrogance of humans to think that they can control a submicroscopic particle that spreads in the air. Okay, so we knew it's gonna spread. It's like turning down the heat on, you got water on the stove and you just turn down the heat to a simmer. Once you turn the heat up, boom, it's gonna boil and it's gonna boil over. So we knew that, and everyone knows, epidemiologists, public health professionals know that's what's gonna happen. So they was supposed to buy us time to set up the infrastructure. What does that mean? We need to get testing capacity in place. We need to get enough contact tracing, disease investigation staff in place. The medical facilities needed to get their infrastructure and their resources available so that when we started to relax restrictions, we would be ready to handle whatever came, right? We saw this in China. Early on, China built 1,000-bed hospital in 10 days. This is why China was so successful. They had the testing, they had the resources, they had the hospital beds, they were ready to go. Korea also did very well. They learned from the past experience with SARS, the original, so as I call it, SARS-CoV-1, and also from MERS. So they got hit twice in the past. So they already knew what to expect. They already knew. They had their testing program and the funding in place, ready to go. So that was the big problem, right? During the shutdown, stay-at-home order, nothing happened. Nothing happened at DOH. They did not hire a single person. Okay. They thought, oh, okay, we beat this thing. It's over. It's gone. We don't need to do anything. So the other side of this, and I believe
Real quick, I sorry to interrupt, but because that was the question I was going to ask. Was it because I mean, that's the conclusion I could come to is they honestly believe, and as Senator Donna Mercado Kim told them, hope is not a strategy. Did they actually believe, even after seeing what was happening around the world, that it was done? That once we did the lockdown, we didn't increase any capacity. Their solution was bring frozen containers so we could put bodies in and build some tents outside of hospitals. And I don't know, it looked like to me like they were trying to put on a show to make people feel like we were getting to a better place. But every expert that we had Dr. Kim from South Korea. He spoke to us of amazing measures that South Korea took by using a simple app that was working so well for the Korean people that would automatically inform people. But we chose to it's not. It seemed to us in the general public that they were just hoping that we're all going to get hit again. That for some reason, Hawaii was different from the rest of the world. Is that really how it was? Oops, wrong one. Oops. What?
I wish I could answer that question. Dr. Sarah Perk sat in an office right across the hall from me, but she did not talk to us. Again, we were not good enough for her to talk to. She did not come to us. She did not ask us questions. She did not converse with us. So I have no idea. I cannot answer for her. I don't know what the thought process was. I really don't. I don't understand it. Now, I believe Tulsi Gabbard talked about this in April of 2020. The CARES Act, the COVID relief funds, was funded by the federal government, and she fought for federal funding for Hawaii. So Hawaii got over $2 billion. I believe it was $2.2 billion of CARES Act money, for the state of Hawaii. $58 million of that money was to go for testing and tracing. $58 million can get a lot of bodies and a lot of chairs Um, I still to this day have no idea where like all that money went because again, they never hired a single person at the Department of Health. They never brought on more disease investigators. They never brought on that was the whole crux of the problem when I would watch on the news media and Sarah Park was out there saying, "Oh, we have, 67 contact tracers. We have 90 whatever contact tracers, 105, 77." The number changed like constantly. It was so like, I don't know. We would just look at each other. We would sit there across from each other and go like, where are all these people? And like, why aren't they helping us? Where can we go to find them? Like, because we were all sitting in there and then she made the comment that a lot of people were working off site and we were like, um, where off site are there? Like, we had no idea who these people were that she was talking about. Because there were literally 10 of us sitting there day in and day out doing this. Now, I don't know. Maybe she was counting the IT staff and the admin staff. And like, I still to this day, we were like, we have no idea who she's adding in. And so I think the issue again is this term contact tracer. There is no job title contact tracer. There was never job title contact tracer. And so I think that was part of it is that people didn't understand that it was a task and not actually a job title until after. So after I came forward and had the press conference and they actually started to train other people at UH and bring them on, they were actually started to job title hire people as contact tracers.
Well, that was your press conference uh, triggered the activity, right? Um, and I just think what would have happened if you didn't come forward? If you didn't come forward that day, I believe Tulsi was there too, right? Yeah, Tulsi was there. If you had not come forward that day and did what you did and shared your story, I I don't know what would have changed. I don't think anything would have changed. I think we would have seen a lot more victims, that's for sure. But I'm interested. At some point, you decided I'm I cannot do this no more. I need to inform public. That's you know uh, a very bold thing to do, and I respect. And I hate the term whistleblower because it just sounds rubbish, but it is what it is, right? But it's especially if you're working in the government, the politics of how things are done. What was that trigger that made you decide I need to talk to someone? I need to I need to let the public know what is really going on. What was that trigger for you?
Yeah, so I think it was several things. I mean, just watching my coworkers struggle, feeling that stress and frustration myself, it was getting so overwhelming. And we just kept crying out for help and crying out for help. And we were being ignored on every level by Sarah Park, by the director's office, by like, come help us. We need help. We need more people. And um, I remember, you know, I remember I would have to drive to parking. So we couldn't even park at the building. They didn't even give us parking. I had to park a mile away and walk to work to go sit there 10 hours a day. They couldn't even give us a damn parking space. And I remember sitting there thinking, or I looked over, actually, this is what happened. The public library is on the corner of King Street and Punch Bowl. And I remember sitting there in traffic, waiting to turn to go down to the parking garage. And there's a plaque on a wall, a little low wall at the public library. And it says, you as an individual and I as an individual can make a difference. And that really hit me hard. It was a very clear sign that I needed to step up and do something because I knew none of my coworkers were going to do it. They were all too afraid. They were all too scared. I don't know why. I don't, I'm not afraid of Sarah Park. Who is she? She's not better than me. She's she's the epidemiologist. So what? I was not afraid of her. I was not afraid of, I knew something had to be done. And we tried. We tried internally and it wasn't working. It was falling on deaf ears. So something else had to happen. Um, my first thought was, okay, I need to call the union. The union is our representative. So I need to call my union rep and I need to tell them what's going on because we're working, we're working up to 100 hours of overtime where we're not getting support. There are people, it was just people were starting to have health issues from working all this time, 10 hours a day, being constantly on call. Like it was too much. And I was like, the union is our representatives. Maybe they have some kind of solution they can help us. So my first call was to my union rep. And when I told him what was happening, they were just flabbergasted. Um, in fact, that day he was like, "You need to go to the press. You need to go to the press." And I was like, "No, like I need to be able to still talk to the public. The public needs to still be able to call me and talk to me and ask questions. I just didn't feel comfortable going like, look, I'm a scientist. I'm not used to being in front of the camera. I like being in the lab with, like animals and petri dishes and stuff. And so like I didn't want to go to the media, go in front of a camera. I wanted to handle this in a way that would get us the resources we needed. Um, so that was my first step. So I went to the union. Um, that quickly escalated. I believe I forget the name of the Randy, the head of the union, I guess wanted me then to go talk to the senators. So the Senate Ways and Means Committee. And I thought, okay, so the WAM committee or the COVID committee, they have the purse strings, they have the money, they need to understand what is happening. So I conceded to that. I said, okay, I will go talk to them because maybe that will help us. So I set up a closed door meeting with the senators. And one of my coworkers went with me one day and I just laid it all out for them. I laid out exactly what I shared with you about, the kind of the org chart for the division, how many there were, how many of us there were. Now, it was very interesting. Something that they had done that I actually kind of used. Um, they had pulled a report again from our disease surveillance system to show each disease investigator how many cases that we had each investigated and how many contacts that we had reached. So they pulled this report and it clearly showed. So for the whole state of Hawaii, there were 15, right? Again, I'm just mainly focusing on Oahu because that's where all my experience was. So there were 15 statewide. There were 10 on Oahu. And I actually had the most cases investigated to that point and the most contacts. I think, again, that data was corrupt because a lot of my coworkers were not able to keep up with the data entry. So I'm sure they had a lot more contacts they had reached as well. They just didn't have they didn't have the depth to be able to put all that into the computer. So again, this is like more detail is outlined in the book. I laid it all out for them. Somehow I had gone in contact with Scott Miskovich, and actually kind of very angry at Scott. And I called him because Dr. Miskovich was not sending us case report forms. So when he was getting positive cases, he wasn't sending us the case report forms. He wasn't sending us the doctor's notes, the medical information for these cases. A lot of times we couldn't contact the people that he had tested positive because he wasn't sending us the information. So I was very upset with Dr. Miskovich. And I called him. I finally found a phone number for his office and left him a very angry message. And I was like, it's a $1,000 fine for not reporting this thing. I got his attention. And I knew that he was connected with Josh Green, Dr. Josh Green. So I finally had a conversation with him. And it wasn't until we had a meeting. So there was finally a meeting with Sarah Park. I believe it was the end of July. July 2020. She finally had a meeting with all of us. And I remember sitting on this meeting and she was like so concerned about public perception. We got to make the public know that we've got this. We've got this. And we're all crying. We're like, not literally crying, but we're like screaming out, like, we don't have this. We need help. Like, we're not keeping up. This is not working. We need something more. And all she could say, and I literally told her in that meeting, I said, I am burnt out. I have nothing more. I cannot do more than I'm already doing. She had no idea all the additional tasks we were taking on. So you can imagine early on, all of our cases were in the Diamond Head area, right? So these were wealthy people. They had their nice homes. They had a separate wing people could isolate in. They could call DoorDash and have food delivered. They were fine. It was great. Let me stay home for like 14 days. No problem. Like, I have all these resources to do this. We knew, we knew when this started to get into the Micronesian population, we would be sunk. We would be sunk because we know about the congregational settings. We know about the multi-generational families. We know how many people are in these little tiny apartments. So we knew immediately when it was starting to get into the Micronesian population, we needed more hands on deck, no doubt. And so when she said, just make sure when you put stuff in the computer, you're entering this metric or whatever. And I got up from that meeting and I went upstairs to the bathroom and I just had a moment. And my husband was actually away. He was on the mainland, so I was by myself and I called him and I was crying. I was so frustrated and so upset that I was like, she is not hearing us. She's not hearing us. We are not able to do what we need to do for all the people that are currently testing positive. We cannot handle this. We need help. I didn't know how else to say it. And I left that day just so upset. I think I had a panic attack, honestly. Um, and I think that was what pushed me over the edge because as I sat there talking, my case count went from like 47 to like 59 in a matter of minutes. And I was like, how am I supposed to do this? Like, how am I supposed to do this? And all she keeps, it was like, cracking the whip, do more, do more, do more, do more. Like, I cannot do any more than I'm already doing. I cannot reach all these people. And we all felt that. And so,
I'm assuming that that was the case for all the people in your office. They were
yes,
all struggling with
yes.
just physically unable to do more.
Yeah. I mean, I was going hoarse from talking so much. I was getting headaches. My coworker had she couldn't even see. She was having eye problems. I mean, it was taking its toll. Now you mentioned, the Department of Health is supposed to be like the the this is supposed to be the overall picture of health for the state, and this is how I view public health is like the Department of Health should be the example, right? We should set the example for the state of health. Okay. They're not even taking care of the health of their own employees. It was such a toxic environment. They weren't giving us the resources we needed. There were no open lines of communication. And if you could imagine how toxic and horrible this culture was, can you imagine the state of the health for the whole entire state? I mean, to me, it's just, that's the most frustrating thing is like, you need to take care of your people and you need to take care of your people on the front lines so that we can take care of the people out there in the community. Like, that was my main argument, and nobody was listening to us. We weren't getting the train. We had people, let me tell you, Mel, we had some of our staff members going out into the public collecting swabs from sick people. Could you imagine? I just kept telling them, like, could you imagine if one of them came back and brought the virus to the whole DOH shut down? Like, what kind of headline that would be? And I told myself, none of those people in that place are trained in biocontainment and biosafety. I manage a biocontainment safety lab. I worked in a biosafety level 3 lab with these viruses. I know what to do. I know what proper PPE to wear. I know how to wear it, how to interact with the virus and all of that. None of those people did. We had people going out and swabbing people who were at risk, had high risk factors. And in one meeting, I told my boss, my supervisor, I said, um, why are we doing that? We shouldn't be doing that. And he said, if you don't like it, get another job. I'm like, could you imagine the headline if they had brought the virus back to the Department of Health and we all got shut down? No
Yeah,
contact happening. None.
I'm surprised that didn't happen. I mean, because remember, this is at a time where that variant was crazy. Yeah, it was a highly contagious, highly transmissible variant. We didn't have the treatment protocols that we have today. So so you do this press conference and this thing goes viral. Everyone in the state is like feeling sick to their stomach because of what you had gone through. And finally, some of the truth was being exposed. But after that, it doesn't help. I mean, I won't say it backfires, but next thing we hear is the headlines that I posted up earlier is they let you go.
I mean,
They got rid of you.
it just goes to, it proved my point. It really just proved my point of how toxic and just utterly shameful, like the whole environment and culture there is. So yeah, after I got in touch with Miskovich and that whole meeting happened with um Sarah Park, I called him again and I said, I need to talk to Dr. Josh Free. I need to talk to him. So I connected with him. He called me the next day. We had a conversation. I shared the performance metrics with him. I mean, he was like, like you said, I mean, everyone knew something was up, something wasn't right, but no one could put their finger on it. So it was kind of like the performance metric report that they had was like the smoking gun. Um, so somehow I think Miskovich is associated with Tulsi Gabbard. And he was like, she wants to talk to you. And I was like, okay, like I can't say no to a sitting congresswoman, like how can I say no to a member of Congress? So I was like, okay. So we had that conversation and she was like, I want to, you need to go to the media. And I was like, no, look, I want to handle this I want to handle this professionally. I want to go through these channels to get people who can actually help us. And I just didn't feel comfortable going to the media. Um, it wasn't until like then she came out and said, we want to have a press conference. We want you to have a press conference with us. And again, how am I going to say no? I can't say no to a sitting congressperson. Like I can't. How am I supposed to do that? Like, okay, so I finally conceded and I was very nervous as you can imagine. But again, I knew now that I had the ear of people who mattered, of people who could make a difference, who could help us, who could provide us with resources. Again, I tried internally. Internally, no one was listening to us. So I had to go outside those four walls. That was the only way um, that we were going to get help. I didn't know how it was going to turn out. Um, I, you know, I had to do something. We had to do something. And I knew I was the person that had to do it. Like, again, I saw that sign at the library and I was like, this is, this is a message, somebody is telling me that I have to step up and I have to do this. And, um,
Did you
luckily at the same
at
time,
at the moment, did you even think that the state would, come up with a a way to get you terminated? Did that thought cross your mind?
of course, certainly. I mean, before I came forward, again, my husband was gone and I called him and I had a conversation, very serious. And I said, look, I have to do this. I have to. And I have to follow through all the way to the end. And I knew one of the outcomes may be that I would not have a job. I would end up without a job. And I I just had to accept that was a possibility when I came forward. And once I accepted that, I was like, okay, okay, it's a very real possibility because I knew the people in that building and I knew how just they were horrible people.
You-
Again,
you
again,
said
it's
no.
like there's more detail in the book that outlines some of the harassment and some of the things that bullying that I experienced working there. But you know what? At the end of the day, I knew what the right thing was. I knew what the truth was. And, you know, I cannot stand liars. I cannot stand liars. And she lied one more time, and that was it. I could not sit there and lying to the public and lying to the senators. And I mean, I could not stand by one more day and allow the lies to continue. And so she was so worried about public perception. I was like, fine, let's just let's just tear that curtain down and let's see the wizard behind the curtain. And then maybe we can move forward. Maybe we can actually start and have a, an effective response. That was my big hope.
Well, it's during those subcommittee or special COVID committee sessions with the senators were live. They were live, and I would be watching them live. Remember now, my brain was a sponge for a long time with all these experts, and I would take notes. And as the Department of Health or whoever was up at the Senate meeting, I'd be texting some of my friends that are senators and say, "Ask her this, ask him this," and they would do it, and it was just a thrill because it was clear that, like you said, they were lying, and they were constantly lying, and whether it was uh, lying to deceive people or lying because they wanted to get through a special committee meeting without sounding stupid, so they just made these things up. It doesn't matter. They weren't truthful with the committee. And the committee was provided with a lot of information. I sent that committee so much information and transcripts from discussions we had had with experts. So I really want to get to the book because I think it's critical that the public get an opportunity to get into the details. Obviously, we cannot do it in the show, but so you get fired, you file a civil lawsuit. I'm not going to talk about the civil lawsuit. Was that ever resolved, or is it still pending? Or
Right. So, initially they put me on paid admin leave for 2 months. After that, the day after Sarah Park was walked out the door, they took me out. And I was like, they are, they just played right into it. It was like, it just again proved everything that it was saying is like, if you're not going to treat your employees right and support your employees and give them resources they need and communicate. And I mean, it's just such a toxic situation. And they just kept proving me right every step. And I was like, sitting at home, frustrated, upset. I was like, now that we need more people, we're one less. One of my coworkers quit, so now we're down people instead of adding people, we're like losing people. And I was like, so the thing that upset me was that day. I hope I don't um I spent all morning trying to sort out my cases, and I had a stack, which ones were in the hospital because we had to follow the ones that were hospital. We had to follow them for disposition. We had to know what happened. Were they discharged? What happened to them? So I had to sort out which ones were hospitalized, which ones could I release from isolation, which ones couldn't be released from quarantine. We had to send these letters, which was a time sunk. Um, and I remember finding one of my cases who had died. And I spent the morning reading through the medical record of this person. And I just still emotional. And I just thought, she needs to memorize all the names of those people who died. Their blood is on her hands. And when I was walked out that door, I was like, what's going to happen to all those people? To all the cases I was assigned, to all those cases that I was following, to all the cases that I hadn't even called yet. What was going to happen to them? There was no one else to take my place. And now what? They're just forgotten. I mean, I was so worried for like, Dr. Emily Roberson came on and I would text her. I'm like, Emily, like, what's going to happen? These 4 people are in the hospital. Like, this is, I was so worried because I was like, no one is going to follow up with them now. What the hell? That was like,
yeah,
you know, and I just sat there at home and it took me a while to finally like finally come to terms with it. And I thought, you know what? This is a historic event, not just for, of course, a worldwide event, United States, but this is an historic event for the state of Hawaii. And this needs to be documented, for the people of Hawaii. Like, I felt like this story needed to be told. And this was my story to tell. And I just said, I have to write this. I have to write a book. I have to write what happened because this was probably go down in history along the burning of Chinatown as the
Absolutely.
worst public health response. And I just, as I wrote the book, it was really interesting to me because, I was in it and I was so chaotic. But as I could step back and started writing the book and it just how it all happened, it was like, you'll see all the pieces come together and how, like you said, the lies, just the constant lies from the beginning and just the unwillingness to step up and do what was necessary. And it's all there. It's all there and it's all laid out. And it was just like, wow, just cannot believe,
And,
you know,
I tell the kids, whenever I come across kids or even my own children who are not kids anymore, they are a part of history. History books generations from now will have this story, but it'll be the story of how they wanted to tell it, right? Uh,
right. Everyone definitely had their own story and they have, of course, all those kids who, my nephew started kindergarten on Zoom and all those kids who didn't get a graduation ceremony. Everyone has a story to tell, and I just thought to document the response effort for the state of Hawaii, you know. So
we appreciate the you taking the time to do the book. Dr. Dworkin wrote a book, Plague Doctors. I don't know if you have read it. It's an amazing book. I ordered your book. I was hoping to get the book before today, but I just, I've been real busy. But it should be here probably today. I bet when this thing is over, I'll walk outside. It'll be at my doorstep. Um, but I did want to spend some time talking about the book. But, for those of you, I know many of our villagers have purchased Dr. Dworkin's book. And it is, he's a, infectious disease specialist. So he was on the angle of how the state failed in their response to COVID as well. I cannot wait to read your book. I just, because I am so familiar with a lot of what occurred. We
right.
followed you. I have to tell you, I can go back on my YouTube channel and go look it up. You were a hero to us, but I'm going to put up the book right now, the book cover, just so that the public or our viewers can see Pandemic in Paradise. It's available on Amazon. Please, I would encourage you all to go get a copy. I love the caption there, an insider's view of COVID corruption in Hawaii. Again, we've suspected it. The problem right now is many of us we've forgotten about the first year and a half or 2 years of COVID, how serious it was, how horrific it was, and how it was managed. And now a lot of people have just pretty much said, COVID is done. We're back to our normal lives. And it's not. We're seeing the spikes now again coming
Well,
around. But
it's when it started, as a virologist, I was like, this could go one of three ways. It could, SARS original came, mysteriously appeared, mysteriously disappeared. There haven't been confirmed cases since like 2003, 2004. So it's no longer on the radar. So it could go that way. It could just go for a while and then disappear and then we don't see it anymore. Or it could just become endemic. So that's just basically what's happening now is that because it's spread and it's become so prevalent that, it's just going to be part of our respiratory virus landscape. And that's just, it's just like flu. So respiratory viruses are seasonal. And so we'll see seasonal outbreaks. And, that's just something that we're going to have to deal with, develop effective treatments and treat people. And, that's just kind of how, this is kind of how respiratory viruses work, unfortunately. But at this point, people have either had it or been vaccinated. So everyone has some level of immunity. So I'm not really worried about, in terms of severity or anything like that. Everyone has some immunity. So I think it's just going to become like a cold virus. Usually what happens in viral evolution is when a new virus attempts to break into a new host, yeah, it causes a lot of mortality. And viruses don't want to kill their host because then they die off too and become extinct. So they want to keep the host alive so that they can spread to others and maintain their life cycle as well. So the point is that they become more attenuated. So they evolve along with the new host and they cause less mortality and, you know, just have more of a congenial relationship. So that's what we see now. Omicron is kind of like oh yeah, it makes you sick. Being sick is not fun. I get it. Like I get it.
You guys are a different breed of people. When we talk to these scientists, the way you characterize this virus, the way you talk about, it's like a congenial relationship. I want to hang out. And,
More
I mean, like
symbiotic.
the working and all these other people, they speak the same language. And I've never thought I would ever enjoy these types of discussions. I'm like, I get growing up, I'm like, hell no, that's not for the smart people, not for me. I get entertained and educated, which is so critical. I have been blessed with having so many experts on this show over the last 3 years that I have gained a true appreciation for what you all do and a true respect, believe it or not, for these viruses and these variants, and that we better pay attention and we better understand how these things work so we can better prepare and protect ourselves. So, before we wrap up, I really want you to take us through the book. I'll get my book today or tomorrow. What am I going to expect as I start reading? Where does it start? Where does it end? I'm glad
Right. So
without divulging too much.
right. So as I said, it's mainly a historic account, the year 2020. So it just goes through from the beginning, 2020, and how it all evolved, and it ends with December of 2020. I do get a little bit into 2021 just to try to wrap things up, because things just continued. Um, and just so you know, yeah, I was on admin leave, and then I came back. When I came back after, I believe it was November 2020, I basically was sidelined. They had me not doing case investigation. I was doing influenza surveillance, which, at the time, flu and kind of largely not disappeared, but it was very low levels of flu. Anyone was sick, the only thing they would test for was SARS. Um, so I was basically just sidelined and silenced and sitting at home, and just out of the blue one day I got a call from Sarah Kimball saying, "We're discharging you." No reason, just we're discharging you. I'm kind of surprised it took him that long. But yeah, so I immediately filed the union grievance and we're working through that process. And also the lawsuit, which again are both pending. So we'll see how that pans out. Um so yeah, it gave me a lot of time at home to kind of sit and write the book and kind of put it all together. And again, I tried to make it a historical perspective. So there's kind of three layers. There's the government response. So the governor, the mayors, kind of what they were doing in terms of their proclamations and what effect that was having. And then the Department of Health. So what's happening with the Department of Health, what their recommendations were. And then my view. So my view from where I was sitting and what was happening with me and my coworkers and how we were handling things. So there's kind of three layers there. I hope that makes sense, and I hope you enjoy the book.
Well, I have no doubt I will enjoy the book. I'm going to enjoy it. And so you are now living on the mainland. Are you being a virologist, or are you just going to be an author and be a award-winning author? And I mean,
Um,
I told the work and I said, how do you just from a doctor just become an author? It's like I've often thought about writing a book, but once I get started, I'm like, nah.
I know. Well, as a PhD, I've written a dissertation, so
Yes, so
it's pretty much a book already. So when I talk to a publisher, they're like, "Oh, there's this editorial process." I said, "Look, I've peer reviewed publications. I've written a textbook in a chapter of a textbook. Like I understand that there's a process. So, it does take a little bit of self discipline to sit every day and to write. And, luckily I had a good publisher who helped me with the editing and put it all together. And, the cover is really nice. And um, yeah, I never in my life thought I would write a book. Never. So
that cover is beautiful. It's pretty and it's well, you can see it on the screen. It's I don't know, it's got this eerie feeling to it. The colors and that daggone COVID little spike ball that's peeking around the side, the edge. But folks, again, this is available on Amazon. I highly encourage and recommend you guys get this book. And uh, I'll do a review of this book once I get done reading it. We'll do it live, and I encourage all of you to participate in this project of evaluating and reviewing the book. Dr. Smith, any closing comments for our villagers here before we?
well, I want to say it is available anywhere you buy books, so not just Amazon. Also, the publisher's website, it's Ballast Books. So it's available widely. I think it's actually in the Hawaii Public Library. Purchased some copies, so you can also rent it from the library. Um, I just want to say thank you to all the people who supported me. I know I had a lot of people reach out to me when I was put out on leave, and they reached out to me via, Facebook and LinkedIn. And so I appreciate everyone's support. It was just very, it was a very chaotic, very stressful time for me. And again, a little bit traumatic. So I appreciate your support and I look forward to hearing your review.
Well, I do me a favor, because I wanted to find you on Facebook, but there's like 1,700,000 Jennifer Smiths on Facebook, and I couldn't find you. I'm really good at that, but I could not find you. So yeah, just look me up and send me a friend request because I really want to follow what you're doing. But I guess what I want to say is thank you on behalf of the village. Like I said, I cannot remember how many times we spoke of your story, and I had tried numerous times through Dr. Miskovich, and we've even had Tulsi on the show as well. But through my cousin Rick, to get that woman to come on our show, totally understand why you couldn't do it. But I just want to say on behalf of myself and the entire village, thank you for standing up for the people. I can only imagine how those others felt. Those other employees that were basically trapped in that same scenario that you were, and just crippled that afraid to speak out because obviously their fears came true for you. Uh, you would think that the whistleblower protection would protect people that have the courage to stand up, and in this case, as of this point, it didn't. And we wish you the best, Dr. Smith. We wish you the best in your endeavors, and we hope you get some resolution with all of this. But know from us that we appreciate you, we appreciate what you did, and I have no doubt in my mind that if not for you standing up that day on that lawn at that press conference, which we all watched, that there would have been much more tragedy and much more families injured and harmed. So in our books, you're a hero, and we appreciate you. We truly, truly, truly appreciate you. Guys, don't forget, Pandemic in Paradise. You can get them at all book outlets. I Googled it. It was a top one, came out on Amazon, and that's where I got mine from. Ballast Books, Public Library, wherever you want. Again, Doc, thank you. Stay safe up there on the mainland, and I look forward to talking to you again real soon.
All right. Thank you, Mel. You have a good evening.
Aloha.
Aloha.
Bye-bye, folks.